fun. I didn't want to have to interrupt you. We are live on Facebook. Very exciting. Brand new technology here. We will be we'll be starting in just about, I would say, 7 minutes. So if you would like more to eat, it came from the Pickle Guild, please chow down. And there's water and other information over there. So in 7 minutes we will begin. So until then, talk amongst yourselves. Yeah, just to make sure that you knew that we knew that it's 6 o'clock and we're not starting on time. I wanted you all to know that I was giving you just a minute to get acclimated. Mm-hmm.
And for any of you that do have Facebook, you can certainly go on and you can share it as well, which is what I was trying to do.
Welcome, everyone. We are currently at Indian Head Community Action Agency here in Rusk County in Ladysmith, Wisconsin. We have been fortunate enough to have a group of rural immersion nurses come up and join us for an experience here to kind of see what nursing is maybe like in a rural area. And from what I understand, it's been rather eye-opening. And as part of their preparation to come here, we looked at what are some of the biggest issues we have facing Rusk County, our whole community here. And so they are going to get up and speak, tell you a little bit about what's going on in these different areas. After they're done, there will be time for questions. At any time, if you would like more food, help yourself. If you need to use the restroom, you go through the exit. There's one right to the left and one directly to the right in that hallway. If by chance there's a tornado, we would go to an inner room, probably in the hallway over there. Right over here, this is where we go. Okay, now I think I've covered everything that needs to be officially covered, and I will turn it over to our nursing students.
Thank you, Julie.
Mm-hmm.
All right. Good evening, everybody. So my name is Tara Rinsai Singh, and we're all senior from UW Medicine School of Nursing. So a little bit about my background. I was born and raised in Cambodia, and my family and I immigrated to the United States back in 2010. So that's where I went to high school and graduated from. And there's a picture of my two awesome younger sisters. They're both in college now, and one at UC Berkeley and the other one is at Northwestern. And I just have to put their picture up there because they're my main support system and my rocks. So that's that. And currently I'm pursuing my nursing degree at UW Medicine. And some of the things that I'm involved with on campus include I work as a student nursing assistant and a nurse intern at University Hospital. And I also work as a student supervisor at Genetic Lab. And during my spare time, I also mentor high schoolers. So kind of like helping them get exposed to health options, health career besides just doctors and nurses. And in community, I also volunteer as a community resource navigator. So I help connect people with resources available in the community. And last but not least, I'm also a nursing chair for Multicultural Student Nurse Organization.
So hi everyone, my name is Pa Vang. I was born and raised in Wausau, Wisconsin. I currently moved to Madison for school. I'm a senior in nursing program. I'm also a first generation college student. I come from a family of 8. I have 4 brothers, 1 sister, and then mom and dad. My experiences and involvement is I currently have my certificate in global health. I'm a Powers App scholar and I'm hoping to get another year for my 5th year. I'm also a certified nursing assistant. I work for a home care agency where I would go into the client's home and see if they need help with personal cares or chores and anything else. I also am a volunteer with the American Red Cross where I would help with blood drives and sometimes work at the office. And fun fact, I love volleyball, so this is my volleyball family.
My name is Deepa Saha. Good evening, everyone. First, I was born and raised in Nepal, the country of Mount Everest and the birthplace of the Gautam Buddha, you may know. I moved in the US in 2011, and after that I started to work as a certified nursing assistant in a facility. I'm also a member and volunteer at NAFA. This is our Nepalese American Friendship Association. I'm volunteer to Red Cross and Medic too. And here's a picture. This is my mom. That's me. That's our traditional dress. And here's my daughter and my husband.
Good evening, everyone. Thanks for coming. My name is Tenzin Kunsang, and
I'm a senior UW Medicine nursing student and also achieving in global health certificate. I'm from Madison, Wisconsin, but I was born and raised in India, and my parents are from Tibet. What I do, like I'm employed as a nursing assistant and med tech in Belmont Nursing Home in Madison, Wisconsin, and also I do a volunteer at Medic, Red Cross, and interpreter for Tibetan community. I have 3 younger brothers all in healthcare related schools and work, and I speak Tibetan, English, Hindi, Punjabi, and still processing learning of Nepali because my boyfriend's family they speak Nepali. And these are my friends and my 3 younger brothers.
Hi, my name is Medan. Actually, I was born in Somalia. Can you all hear me? Okay. I was born in Somalia, and if you guys know, Somalia still has like a civil war that's going on. So my family migrated to Kenya when I was 3 years old, and there is where I grew up till I was like 18. And my family and I moved to United States 2012. Actually, my mom came first, and then that's how I ended up coming. So I'm a green card holder. I'm here 5 years now, and probably become 16 soon. So I'm a first generation student. I come from a large family. I have 8 sisters and 5 brothers, and mom and dad. 1 mom, 1 dad. I insist on that because in my culture, a man can marry up to 4 wives, and my dad didn't. So I'm a nursing student and also working on my global health studies. I'm interested in women health, and I also love oncology. So I work as a CNA in a nursing home, and I also interpret for Dane County as like I interpret Somali language and Swahili language. I also take care of my 6th sister. Like I have a sister who is a stroke survivor, and I also take care of my mom. I volunteer with medics and Red Cross, and also like now we fasting as Muslims, so I do volunteer at our local mosque. And that's all about me. Thank you.
I'm Emily. I'm from Oconomowoc, Wisconsin. And what I'm involved in are things like Camp Kesem. It's a camp for kids whose parents have cancer, so it's a free week of camp for those kids. I'm also involved in Medic. I do schedule the flu shot clinics for that in the fall and do the scheduling. I also work and volunteer and I work as a nursing assistant at the Children's Hospital in Madison, and I'm a nursing home and a rehab and long-term facility as well. And I'm interested in pediatrics. This is a picture from camp, and I love my little kiddos.
All right, and I'm Shane. This is a picture of me and my 2 best friends from nursing school, Anna and Aaliyah. Just have to give them a little shout out. I'm from Lake Mills, which is outside of Madison. I'm also a first-generation college student. And some things I'm involved with on campus, I'm on the UW Spirit Squad. I'm a nursing assistant at UW on the transplant surgery floor. And then back home, I help out with the Jefferson County 4-H and Meat Animal Project. And I've been involved with that for over 15 years now. So first, we're going to talk, well, our topics today are alcohol and other drug addiction, mental health, the aging population, and housing issues in the area. As part of our clinical practicum, we were given the task of choosing a health promotional topic, doing research for Rusk County and the surrounding areas, and then we've been presenting at the food pantry, in the high schools, really to anyone that will listen to us, and we're happy to share our presentations with you all tonight. So alcohol, everybody's familiar with it. A lot of people don't know what binge drinking is, so we're educating tonight. Binge drinking for women is defined as more than 3 drinks in one sitting or more than 7 drinks in a week. And for men, it's more than 4 drinks in a sitting and more than 14 drinks in a week. But these are standard drinks, so that's 1.5 ounces of alcohol, a beer, 8 to 9 ounces of malt liquor, or a 5-ounce glass of wine. And up here, and even in Madison, the bartenders tend to make drinks very strong, so you think you're having 1 drink, when actually you're having 3. So we want to raise awareness that 1 drink is not really 1 drink unless you are actually measuring the amount of alcohol going into it.
One thing we
took from statistics in this area was that 50% of binge drinking males between the ages of 17 and 20 will continue to binge drink as adults, and that survey was taken around age 30. And then for women, it's about a third of women ages 17 to 20 who are on this binge drinking scale will continue to binge drink as adults, which is really quite a high proportion.
So this is I think, functional MRI of a 15-year-old non-drinker and a 15-year-old heavy drinker. And what they do is they give them a memory task or like a math problem and see which areas of the brain light up. So on the left, you can see that there's a lot of brain activity, good connections going on. And then on the right, you can see there's only these few areas that are lit up. And that's because the nerves and brain cells in these areas have died and there's not good connections forming. Because as you're aging or developing in your adolescent years, your nerve cells are still developing and your brain is not fully matured until about 27 years of age. So that's why the drinking age is 21, because we want to minimize the effects of alcohol on the teenage brain.
So this was a really interesting statistic that we found, was that only 1% of parents believe that their teens will binge drink, when in reality 18% of Wisconsin teens binge drink, which is a very, very high portion, and it's something that parents are just unaware of. So something we really want to preface this entire presentation on is that addiction is a disease, and we're going to be talking about a lot of different addictions with smoking, drinking, meth, etc. And we have been raising awareness also with the teens not to look at someone as though they're a bad person, but they may have made a poor decision and now they need help. So we really want to raise that awareness that they can come to you and other adults to get help. And it really can happen at any age as well.
So next we're going to have Pa come up and talk about marijuana.
Alright, marijuana, what a fun topic to talk about. So, marijuana, as you guys may know, that it's also known as weed, pot, bud, or Mary Jane. It comes from the plant Cannabis sativa, that's the main one, the red up there. And it contains the active chemical called THC. Now THC is the chemical that's responsible for the psychoactive effects. People use marijuana for various reasons, such as for medical reasons. It's mainly used for seizures, pain, and cancer. And also it could be due to peer influences or family influences, role model influences, and sometimes people just use it for recreational use. I do want to emphasize that the medical marijuana contains the CBD, cannabidiol, instead of the THC, which is the psychoactive part of the plant. The CBD does not contain, is non-psychoactive, and it doesn't cause you to get the high. So currently right now, marijuana is legalized in 28 states plus this District of Columbia. And every state varies in terms of the regulations for marijuana. For instance, in California, you have to be 21 years and older, and you can possess up to an ounce of marijuana and own up to 6 plants. This should be a concern for all of us because California is a huge economy in the United States, which means that other states may be influenced by California's legalization for recreational use and may follow California. And then this is a chart that was done by University of Michigan in 2013 about the percent of students reporting use of marijuana in the past year. And the red is 8th graders, yellow is 10th, and the green is 12th graders. So as you can see, 8th graders and 10th graders' use of marijuana in the past year has decreased by a little bit. For the 12th graders, the use has increased. This is mainly due to the lack of awareness of marijuana having health effects and the low perception of risk for marijuana. Health effects of marijuana. So there's short-term and long-term effects for marijuana. Short-term effects is altered senses, such as having slower reflexes, impairing your short-term memory, and having difficulty concentrating, which can lead to increased risk for motor vehicle accidents. Marijuana can also cause changes in your mood, so you may get mood swings. You may feel joyful and happy, and also feel depressed, especially when you're off the drug. Marijuana can also cause a decrease in your ability to think and problem solve because it affects parts in your brain. You can also get an increased heart rate which increases the risk for heart attacks. And this is concerning for the elderly population and for those with health problems. Long-term effects of marijuana is that you can get impaired learning and thinking abilities again, since it affects parts in your brain, mental health problems such as depression. So marijuana doesn't directly cause depression, but people who are already depressed and use marijuana may get more depressed over time. Marijuana is also linked to bronchitis, which is inflammation of the bronchial linings. This is a tube that carries the air to and from your lungs. It can also cause, it doesn't cause, but it's linked to lung cancer because of the carcinogens that marijuana contains. And this is similar to the carcinogens in tobacco smoke. And like many other drugs, marijuana can cause addiction, which is when the person compulsively uses marijuana and uses it in uncontrollable ways. So how does marijuana affect your life? So marijuana is associated with less academic success. There's a study done by the University of Maryland in 2013 in which a study followed 1,200 students across a 10-year period, and the study found that these students were using substances, especially marijuana, which contributed to less academic success, dropping out of college, skipping classes, and not having a job after college. Marijuana can also lower your IQ by about 8 points, which is a large amount of points. Marijuana can also cause relationship problems with family, friends, and partners. So especially if the marijuana user prioritizes the marijuana and feeling high over their partner, family, and friends, that can be frustrating for the partner. Marijuana also can cause a person to not feel like themselves and feel low, especially when they're not on the drug. It also can contribute to emotions where it can change the person's mood, so the person may have mood swings. It can also lead to frustration among partner, families, and friends. In addition, users of marijuana may be isolated because they associate more with a group of people that are also long-term users of marijuana. Another thing is that marijuana can link to and contribute to psychosis and panic disorders such as anxiety, but this is short-lived, so it doesn't stay for a long time, but it can be distressing for the person using marijuana. So there's some resources for people to get help. If you're a long-term user or you're trying to be sober from marijuana, behavior support services is helpful because marijuana does cause, behavior issues and changes in your mood. Treating the underlying causes such as anxiety and depression, and then psychosocial support is also very important. So no one wants to be alone when they're trying to stay sober or trying to quit marijuana. It's very important that they have a good support system, either whether that's friend, family, or other relatives. And then rehab facilities can help the person with counseling, just someone to talk to, and education. Another resource I found helpful is a website, drugabuse.gov. If you want to learn more about marijuana or need more information, that would be a great resource to look for.
Okay, now we're going to be transitioning into methamphetamine.
So methamphetamine has increasingly been a problem, especially up in rural Wisconsin, where we are. Since 2010, I'm not going to read all of these statistics, just the ones that I find appalling. Since 2010, grams of meth seized in Wisconsin has risen by 1,592%, which is quite large. And then the state crime lab has analyzed cases, and that's been increased by 349%, and that's just since 2010. So that tells me that meth has been a growing problem in this area, and some people do not believe that.
So one thing here, we have this picture over here. This shows the red is 30 plus crime lab cases seen in the county, and as you can see, in just a few short years, Rusk County has turned red. So these are some of the short-term effects of methamphetamine. Why does someone do it? Immediately, it affects their pleasure center in the brain. It makes them feel good. It makes them feel upbeat and excited. However, immediately you also have things like insomnia, dry mouth. You get more anxious, a little irritable, and a decreased appetite. This is a picture of what the drug will look like unless they make it at home. That can be a problem up in this area because people will make it on their own with things like battery acid, acetone from nail polish. It's really quite gross in the components of it, and that's why it does things like this to your face. So why it does this is we'll get into the long-term effects in the next slide. But you develop these psychotic features, that anxiety and irritation actually turns into a psychosis, and you believe there are bugs crawling in your skin. So you pick at it, and that's what causes these pock marks.
So the long-term risks of meth are addiction, and then also meth mouth, which is this picture here. It destroys your teeth and your gums and causes a lot of problems. This picture here is what meth might look like if somebody makes it at home. They call it fluff. It's also kind of like leftover after making it. And then this woman, this is just 4 years in between these two pictures. And as you can see in this picture, she looks malnourished, her hair is destroyed, her eyes are sunken, and then she has all those pock marks that are characteristic of meth users. And some other long-term effects are those psychotic behaviors, memory loss, weight loss, and then strange or violent behavior. Hidden in Plain Sight is a initiative put on by the Housing Urban Development, and it's trying to raise awareness to parents about possible hiding places for drugs that teens might use. Our goal with this is not to make everybody paranoid and go immediately searching their teens' rooms, but we just want to bring awareness, and that's really what this evening is about, awareness about issues in our community.
So here are just some common things. This one is just a clock that you plug in and has a battery place. So they'll put things in the battery hole. This looks like a highlighter, but it actually screws off and it's a pipe that's in it. This is a water bottle that it looks like a normal open water bottle, but then it screws off in the middle and there's a compartment inside, which is the same concept for the Axe bottle, which is a cologne, and as well as the next one's on the slide. Do you want to talk about this one?
So this toilet paper roll with a dryer sheet over it is something that people might use to try and mask the smell of smoking drugs. They smoke through the dryer sheet in toilet paper, and it helps to mask the smell. Doesn't do a great job, but it helps. And then on this slide, so this lint roller and hairbrush have tops that screw off, and there's a compartment in there. There are boxes that look like books, or an actual book where people will cut out the pages, and then there's a hiding compartment there. These cans are interesting. They actually pour cement in them to make them about the weight of an unopened can of soda, and then the cement actually cools it, so if you were to pick it up, it would feel like a full can of soda, except that it won't slosh around. And I was amazed by these. I didn't think they were actually hiding places. And then this clothing company is interesting. If you see this crown anywhere, it means that there is a compartment somewhere in that piece of clothing where you can hide something like drugs.
Okay, so moving on to our different topic. Again, we don't want to scare parents, and we really don't, but we do want to raise awareness for the things that can happen if you do have your teen around these drugs, or things like smoking. Because Rusk County has quite a high smoking rate at about 18%, and one of the things we really want to bring awareness to for parents, for guardians, anyone that's going to be around teens or children, is that you really want to keep that smoke exposure to a minimum for kids, and you want to decrease the amount that they see you smoke. So one of the things we learned was that 50% of cancer deaths are linked to our behaviors, and a large piece of that is habits like smoking. And secondhand smoke can be just as bad, and thirdhand smoke, which is when it's on your clothing, can be just as bad as the direct inhalation. So things we want to recommend to parents if you're not able or willing to quit at this time, that you would consider either stepping outside only to smoke, and when you are outside, if you could put a specific jacket on and a hat for women, put your hair up and put the hat over it, and take them off then before you go inside, because we really want to limit the exposure that kids have. And we do understand that it is very challenging to quit because it's so hard to start, so easy to start, and so hard to quit. So we do have some resources on the next slide. And as a little bit of incentive, just some of the risks. Everyone knows about lung cancer, but the other risks are that you can have bad vision, more anxiety, you get sick more often, you have bad teeth, you get early wrinkles, and erectile dysfunction. And here are some of the resources.
So the Center for Disease Control has this great campaign. There's tips on there. There's other resources. I think they actually will send you a nicotine patch kit to help you get started. And then there's also this handy phone number, 1-800-QUIT-NOW, and you can call and they'll get you connected with great resources to help you quit smoking. Next, we're going to talk about some prescription drugs. So, show of hands, how many of you have taken opiates like oxycodone, Vicodin after surgery or another injury? Sure, everybody's familiar with them. A big problem is that doctors tend to overprescribe or give you too many of the pills. So you only take a couple of them and then you have a half full bottle of pills sitting in your medicine cabinet. Well, that causes a problem when your son, daughter, or grandchildren come over and then there's easy access to pills in the house. These medications can be extremely addictive when used incorrectly. And half of the drug overdose deaths are from prescription drugs. They are the number 3 most commonly misused substances by Americans over 14 years of age, and they can have many of the same dangerous side effects as drugs that are made illegally.
And especially for teens, we see a problem with them where they're drinking and then they decide to take a pill, whereas drinking already decreases your respiratory rate, so you're breathing slower. And then if you take one of these pills on top of it, it will decrease it more, and that's how kids overdose and die. So we have the next section is how you can be safe with your prescription drugs.
Okay, I'm going to talk about how to reduce misuse of prescription medications. I have divided into 3 categories. First, safe storage, safe dispensing, and knowing the medications. Okay, safe storage. I'm pretty sure like you guys have grandchildren or young kids coming over home and like they like to explore things. So making sure like your medications in a lockbox like this, you can get it in Walmart or in internet for cheap ones. So making sure like place and store everything in a lockbox. And also like set aside all the medication in one place instead of like putting some on kitchen table and some nearby the nightstands. So that way we don't mix up like one medication we took, or also like keeping a small notes like this nearby the medication, so that way whenever you guys took medication, what time, what dosage, and write it down, so that way like to prevent misuse or overdose of the medications. And the third one, do not remove all the labels from containers. Like some of the medications, like they look alike and the words kind of like the similar, like oxycodone and oxycontins, like they are totally different medications. Oxycodone is immediate release and oxycontin is like extended release, so that way like it's kind of looks similar and similar words and similar kind of looking, so it's easy to get mixed up. Okay, second one is safe dispense. So like whenever you have unneeded expired prescription medications, you can drop off at pharmacies, local pharmacies, or a local police station instead of flushing in a toilet or throwing in a garbage. Because if we do that, flushing in a toilet, you know, like all the sewage systems, like they go to like oceans and lakes, and it impacts the fish and the mussels and all the aquatic animals, and it like disturbs their genetics and behaviors and reproductions. And also like putting in the garbage, and you know like our kids and pets, they like to dig in, and it's more likely to cause overdose, accidental overdose. Third one, knowing your medications. So like when you get medications, like knowing what is it and what it's for, and how many dosage you can take in one day, especially like prescription drugs. On the label it says 2 to 3 or 2 to 3 as needed for 4 hours or 6 hours for pain, but we have to look like how many dosage we can take in one day, so that helps to prevent overdose of prescription medications. Also knowing the interaction between other medications, like what other medications you're taking, like is there any interactions, so knowing those are really important. And also never mix medication in one bottle, like especially like when you are hurry or when you're traveling, you putting all the medicine in one container, so that way it's easy to mix up like which medication you're taking. And I have a video of accidental overdose victims on YouTube by CNN.
So it's a misconception that I would have to take a lot of prescription pain pills and drink a lot of alcohol to overdose. The fact is it may not take much. Prescription painkillers and alcohol both depress breathing. Using them together could cause you to slip into a coma and die. 21-year-old took Xanax, oxycodone, and alcohol. He died of mixed drug toxicity. Misconceptions that only addicts misuse or abuse prescription painkillers. People who use and abuse painkillers start off with legitimate prescriptions for an injury or after surgery. This is a 42-year-old who took hydrocodone and clonazepam, and it was mixed drug toxicity. Misconceptions that I found some in my mom's medicine cabinet left over from an old one, and it's safe for me to take for my migraine. Never take a pill that is not prescribed to you. You cannot be sure that the dosage is right for your weight and health background. This is an 18-year-old who took a single dose of Oxycontin. Misconception that if it's prescribed by a doctor and dispensed, they're always safe. The fact is that prescription drugs are safe if you use them as prescribed for you. Using them differently could cause complications or an overdose. This is a 25-year-old who took methadone and died of respiratory depression. A misconception is it's safe to increase my dosage without consulting my provider. But you never increase your own medication. If you feel like your medication isn't working, please speak with your provider. 26-year-old took Ativan and alcohol and died of asphyxiation.
Thank you, Emily.
Our next topic we're going to be moving into is mental health.
Mental health is a big issue, especially in the teenage population. Hormones are changing, there's stress from school, stress from families, and a lot of people don't really think that mental health issues are a real disease. In reality, they are, and people need to be connected with resources to get through these challenging times. The Communities That Care survey performed in 3 area high schools in Rusk County revealed that 48% of high school teens feel depressed most days of the month. That is shocking to me. I just can't imagine having no one to talk to about those symptoms and just only feeling depressed most days of the month. That survey also revealed that the teens didn't feel like they had somebody safe to talk to. And depression can be genetically linked, so if you or your grandparents have had problems with depression, there is a chance that your children may be affected as well. One way you can help is simply by asking your kids how they're feeling. It may seem awkward, but opening up that line of communication is a great way to build trust and let them know that you're really there for them. And it's important to take them seriously no matter what their concerns are. And then let them know that they can talk to their teachers, school counselors, their school nurse, and most importantly you, and that you are there for them.
And this was really interesting. It was that 1 in 4 people globally will experience feelings of mental health concern throughout their lifetime. So it's really quite common.
Next, we're going to have Marianne come up and talk some more about mental health.
I'm gonna talk about ways of helping, like ways of decreasing stress and ways of taking good care of yourselves. So one of it is talking about your feeling. You can always find someone to talk to. It can be a friend, it can be your mom or someone you feel close to. You don't have to keep your stuff to yourself. It really eats you up and really consumes a lot of your mind and your time. So it always feels good to talk to someone. You can always keep yourself busy, like active. You can exercise. You don't have to go and sign up for a gym membership. You can go out for a walk. If you have a bicycle, you can cycle. And now that summer's coming up, outside really looks beautiful. So let's all take advantage of that and just enjoy the nice weather. Always eat healthy food. So junk food is really something that makes you really get addicted, and you just keep eating. And when you keep just eating, you just want more and more of that, and it really damages your organs and stuff. So drink sensibly. I'm not encouraging people to drink, but just like Shane talked about the requirements of drinking, you can opt for water just like me. So keep in touch. It's always good to keep in touch. Talk to people that who loves you and whom you love a lot. Always call people and ask how they're doing, and also ask for help in return. You don't have to always be needy. You can also be listening to other people too, and be there for others. Take a break. That's very important in our lives. I know sometimes we can be so busy, especially as like nursing students, but we really take breaks and we really take time and just give yourself some time, sit back and relax. You can even take a bathtub and just relax a little bit. So, okay, do things you're good at. It's always nice to do what you're good at, and always ask for help what you're not good at, and it's always nice when you teach others what you are good at. It's not like everyone else in this room knows like what someone like what Tenzin is good at it. So we can always like share what we know, and that's how we all grow and learn. So the other thing is accept who you are. Just know that there's only one of you in this universe, and you're really unique in your own ways. Just know that there are ways you can touch other people's lives, and you can change people in ways that you do not even know. Care for others. You don't have to be a nursing student to do that. So you can always care for others just by doing little things, or even saying hi, or just smiling at someone. That can really change the whole day for someone. So next Jen is gonna talk about resources that someone can use in finding help. Thank you.
If there's an emergency, call 911. Any emergency, even a mental health emergency, they will be able to help you. There's also the National Suicide Prevention Lifeline. There's resources in Rusk County, which I found just by Googling. The one I'm really excited about is this Hope Line crisis text line, 741-741, right up the left side of your keypad. And you can text somebody anonymously about issues that you're having. And then also the health department and the law enforcement agency. And then we also want to just say that there's the Embrace shelter for victims of abuse. And then the Rusk County Shelter and Crisis text line is also available.
You also have a lot of those resources on the cards that are in front of you on your table that has that text line, and there are, I think, 4 resources on there for that we'd love for you to take today. Even if you don't feel that your child or your grandchild needs it directly, they may have a friend. Have them put it in their backpack, bring it home. You never know who really does need it.
Our goal is to make sure that the population that needs these resources has access to them. Next, we're going to talk about aging population. Who's up? Tenzin?
Now we will discuss a few common health problems may be experienced by elderly populations, and I will talk about the blood pressure problems. So blood pressure stages. High blood pressure is a major factor that contributes to heart disease. In preventing high blood pressure, you are also preventing future heart disease. So low blood pressure means a blood pressure less than 80/60, and a normal blood pressure range is 80 to 120 over 60 to 80. And over 120, over high blood pressure is over 120 over 80. So when you go to clinic and the doctor says like you have blood pressure 120 over 60, means the first number 120 is in medical term is systolic. That's when heart contracts, and the lower one is diastolic. That when heart relax. So high blood pressure in medical terms, pretty much they use hypertension. Hypertension can refer to as silent killer, and almost has no symptoms until like you already had cause damage to bodies. So heart disease is the number one leading cause of the death in United States, both men and women. 600,000 people in US die each year from heart disease. In the US, someone has a heart attack every 34 seconds, and high blood pressure leads to this. High blood pressure in combination with obesity and smoking, 2 to 4 times more likely to get heart disease, and risk drops by 50% even a year after smoking, like quitting. So reducing high blood pressure, what we can do to reduce high blood pressure? Increase physical activities, like unless like 30 minutes we can do a day, it's enough. Or reduce salt intake, or lose weight, and limit alcohol intake. 1 drink per day for women and 2 drinks for men. And stop smoking and take medications if you are prescribed for high blood pressure. Now I will talk about low blood pressure. In medical terms, they use hypertension. Some of the causes of low blood pressure is prolonged bed rest, like especially when you take a nap for a long time and when you get up suddenly, and we called it orthostatic hypertension in medicals. And also neurally mediated hypertension, that's like when you're standing up like so long, that time like heart and a brain like miscommunicate. And nutritional deficiencies, like some of the nutritionals like vitamin B12 and folate, and decrease in blood volume, and certain medications like diuretics, we call it water pills, and some hard medications like beta blocker and alpha blockers, and some antidepressant, and some Parkinson's medications, levodopa, and if you have a heart problems, that can also cause low blood pressure and severe infection as well. So complications and risks of low and high blood pressure, what it does is we can have vision loss, kidney damage, and fluid buildup in the lungs like pneumonia, and memory loss. So what we can do to prevent a low blood pressure? Drink more water, we have to be more hydrated, and exercise to promote blood flow, and use more salt. But this one you guys have to check with the doctors. Because using more salt, that makes our kidney to store more water, and when you store more waters, then the blood pressure goes up. So, and also avoid standing still in a place for a long time. Take a break and sit down for a few minutes, and try eating smaller and more frequent, and rest after eating. This one is common in older population, when like in normal people, like when they eat, the blood pressure like goes in digestive systems, and it helps for digestions. But somehow in older populations, it lacks those blood pressure in digestive systems. That's why they will have hypertension and blackouts and stuff like that. And the last one, wearing compression stockings, like a TED stocking we call it, and these are really important because those makes lower extremities more tight, and the blood pressure goes up in the upper bodies, and heart more functions, able to function better. And some of the signs and symptoms of high and low blood pressure is high blood pressure, you'll have headache, vision problems, nosebleed, and blackouts. And low blood pressure, you feel dizzy, or blood visions, or irregular or rapid heartbeat, or feeling nauseous and confused. Now Marion will talk about diabetes.
Okay, diabetes is a chronic disease in which the body's ability to produce or respond to the insulin hormone, which is produced by our pancreas in our bodies. So, types of diabetes, this type 1 and type 2. We have pre-diabetes too. So type 1 is when the body does not produce enough insulin. So what the healthcare provider does is we give people insulin. That type 1 mostly happens in childhood and it's not associated with body weight. It can be for people who are skinny. So type 2 diabetes is body produces insulin but cannot use it well. And type 2 is mostly associated with weight and it's increased by age. So what are signs and symptoms of diabetes? Some of the signs and symptoms are fatigue, dry mouth, and they have a sweet smell in their breath. So they frequently feel hungry, they're dehydrated, and they really have increased thirst, blood vision, and there's weight gain or weight loss. And when they have a wound or cut, it doesn't heal quickly. It really takes longer for it to heal. And they really have issues with their skin. The skin is really very dry. So some of the complications, sorry about that, the skin. So complications occur like after a long time of someone having diabetes and when it's not controlled. Mostly some people do not know they have diabetes. So after a long time of someone having diabetes, it really affects your brain. It can lead to stroke. It affects your eyesight and it affects your nerve. It makes you tingle and numbness in your hands and legs, mostly your legs. Can lead to heart diseases and kidney issues. Okay, so these are just some statistics I found. So diabetes affects 29.1 million people in the United States, so that's high and it keeps going up each year. So these statistics are from 2016. So and there's an estimated of 8.1 people who are pre-diabetes. That means they have high blood pressure but they do not know. They have high levels of glucose in their system but they have no idea. They're just normal just like us. So there's also 86 people who are pre-diabetic and still do not know. And the scary thing is diabetes is the 7th leading cause of death in this country. So some risk factors. So one of it is being obese or overweight, and the other thing is sedentary life, just mostly working in an office or not having enough movement around. Family history, just like me, both of my families have diabetes, so that can put me at a high risk of getting it. So the other thing is increased age and a blood pressure of higher than 140 over 90. So how can we prevent diabetes? These are some ways of preventing diabetes. Eating healthy food. So these are some choices: increasing your fiber intake and greens like vegetables, and being more active, and also that helps you. When you combine those two, will help you decrease some of your weight. So now Deepa's gonna come and talk about fall prevention.
Hello everyone, I'm going to talk about how to prevent fall in homes. Okay. So if an older adult in Wisconsin dies because of any accidental injuries, chances are he or she dies because of the fall. So according to Wisconsin Department of Health, the falling is the leading cause of accidental death among Wisconsinites 65 or older. This cause is outpace the motor vehicle accident now. So 7 in 10 people hospitalized in Wisconsin because of fall were 65 or older. These are older population. More than 1 in 10 people admitted to nursing homes and had fall that resulted in long-term stay. So I say so how do we care about fall? Most fall occurs at home, so I say fall is bad thing because fall makes difference between continue your living independent life, healthy life, to the someone having you help in this healthcare settings. So I found one statistic there: every 20 minutes an older adult dies from a fall in the United States. That's crazy. So A fall often results from multiple factors. For instance, general loss of strength of balance, medications that makes people dizzy and impair alcohol use that can be overused, or alcohol and medication interactions. And another most common problem is impaired vision. So I want you to go to eye doctor and get an eye checked. And other thing is fear before that. Sorry. Okay. Another thing is fear of falling. That makes people to do activity less, and that tends to making a people prone and more prone to fall. I have one thing before that one. I would like to request the family members to take care of their family by finding programs for their loved ones, and the help on modifying homes after the recommendation from the home visit. And also, family, please talk with the healthcare professionals how to prevent fall at homes for your loved ones. And those who do not have any supports at home from families and friends, they can rely on communities like here Indian Head for Rusk County, and our church, senior centers, or any other organizations. And here's a picture of a flip-flops. This one looks beautiful, cheap to buy, and easy to wear it, but it is very dangerous and tripping. And another is the fur mat. This is cute to have in home, but it leads you in. You can trip and sleep on it. There's a pets. Has anyone tripped over a pet here? So I would like to suggest to keep the pet in one place in house. So I don't want to say throw them away though. That's a part of the family. So moreover, you can remove the cutlers on hallways and your pathways in the home. Keep items within reach so you don't have to reach over and lose your balance. Clean up spill immediately when you can, and always use rails while walking on upstairs, stairs, and hallways. And lead pathways. I have one picture here, the motion lights. And stay hydrated. But I would like to recommend it not to drink more than 1.5 glass before you go to bed. Because if you drink more before you go to bed, then it tends to, you have to wake up multiple times in night, and that leads to fall. So exercise. Exercise improve your balance by making your muscles stronger and flexible. So there's less fall than decrease hip fractures. And also maintain health and independence. And another is walking. Walking is a great way to maintain or improve your strength and balance. So use a walking stick or the walker if you need it. So here is some exercise. I'm gonna show you how to do this. And here's standing sit raise, leg raises. So just sit it there. If you like to join me, then feel free. Just a little bit forward and just hold securely on the side of the chair. And raise your right leg first. And our focus point is to make a 90-degree here. So make sure your back is straight. So only hold for 2 seconds and put it down slowly. And another one, same thing. Thank you. And another, I want to do flex both legs same time, just like that. Don't hold your breath. I want you to breathe slowly and easily. And another one is rocking motion. That's a so easy one. So just you are just pretend you are going to stand up like 1, 2, because I like that. That makes you strengthen the hands there. So Okay, I'm gonna do the another one for your legs. If you'd like to stand up, just go back of the chair. At home, you can use chair or any side rails, whatever you want. Okay. And lift your right foot 1 inch off from the ground and just take away from your body. And hold for 2 seconds and put it back again. And similar things. Lift your left foot 1 inch off from the ground and away from your body. So these kinds of exercise helps you gain more strength and balance. So now my another friend, she is coming to talk about the housings.
Alright. Thanks, Deepa. So I'm going to wrap up our town hall presentation with one of my most favorite subjects, housing and health. And so I have a picture of this picture. So for many of us, the word home means more than just a shelter. It means warmth, love, family, and also belonging. And if you can look at this Maslow hierarchy of needs, you can see that home means more than just a shelter. It means security, safety, and especially it's one of the most basic needs that we all need to have in order to attain our full potential. But however, right now in our country, there's so many people who are facing with housing issues, and one of them is unsafe and unaffordable housing. So this is a table that I got from Indian Head Community Health Assessment, and it shows the housing demands in rural northern Wisconsin. So you can see that like there's the number of people who on the waiting list are quite big, and the length of wait is between 6 months to 2 or 3 years, and sometimes there's no opening available for people who need help with housing assistance. So why do we care about safe and affordable housing? The reason why we care about safe and affordable housing, like I mentioned earlier, housing is one of the primary bases of life, and it's where we form our identities, where we connect with our neighbors and form social relationships. So health and housing are closely related, and access to safe and affordable housing leads to good health. And for me and my partner Pa, we had a great opportunity to work on a housing project, and our goal was to explore the health outcome when affordable and safe housing are not available. And also I just want to share that I got interested in this project because I started reading a book called Evicted, and it talks about the challenges that most Americans face nowadays, which is unsafe and unaffordable housing. So my method of my housing project was we interviewed landlords and tenants in order to hear their perspective about affordability and safety in rural Wisconsin. So some of the things that we have found based on what tenant and landlord said, and also based on the literatures, are high. So barriers to affordable and healthy housing are due to high costs, low-paying job, and ineffective voucher or federal assistance programs. And I was quite struck by the information that I have found, because majority of poor renting families spend half of their incomes on a housing cost. And this is particularly challenging especially for a single mom who has to work 84 hours a week, 52 weeks of the year in order to afford a 2-bedroom apartment. And this is not to mention that when they lack transportation and childcare services, this put another strain on their family. And I know that there's some federal assistance program out there and some voucher programs who intend to help people relieve their financial strain, but they have not been shown to successfully achieve what they're set out to do. As we know, that 2/3 of poor renters do not benefit from federal housing programs. So on top of just barriers to access safe and affordable housing, unsafe and unaffordable housing lead to many health and social problems. For example, one of the most common health problems that people face is lead poisoning and asthma. And this is particularly important for people who have children, because children have a greater risk to lead poisoning, partially due to the limited housing options that they have, And for example, if the house has not been redone for quite a while, that put them in even a greater risk. And another important factor that I found was mental health. So according to the data that we found, 1 in 2 evicted mom face mental health problem even after years of being evicted. So when I talk about mental health problem, it includes depression, substance abuse, and anxiety. And like Deepa mentioned earlier about older population, we know that the elderly population is growing very rapidly, and by 2050, 50% of the population are older population. So we really need to start thinking about how can we make our house safe so that they have a proper accommodation for fall prevention. And last but not least, some of the social issues that can be caused by unsafe and unaffordable housing are homelessness and poverty. Because when you do not have a stable, decent, and safe house, you will be more likely to not able to hold your jobs, and that can lead to homelessness and poverty. So can you go back to the slide? Okay, so I forgot to mention this picture. So I took this picture when I went out with the Red Cross team about a week and a half ago when the tornado hit. And this is the picture that I took. So this picture really shows that when you have unsafe and unaffordable housing, and when the disaster happened, it put another stress on you and your family. And this is the quote that one of my colleague, Emily, recalled from working with people who came to Red Cross for aid. And it reads, "People are coming and saying they only need a little something when the whole side of the house is missing." So it really showed like the traumatic incident that has on the family. So I also wanted to share that while I was out in the community with the Red Cross team, what I saw was very heartbreaking, but also hopeful. And what I meant by that is that I saw people coming together and extended a helping hand by providing food and water to one another. And it made me wonder, what can we do as a community that we can help each other out, not just when disaster happen, but also when on a daily basis when we need help, like with safe and affordable housing. So, and it doesn't have to be big. You can just start. This is some of the suggestions that you can do on an individual level. For example, community engagement, collision development, when everyone are together, for example, landlord, tenants, and all of us are at a table, we can talk about this housing issue as a community. And another way that we can do is to increase voice and representation of tenants so that we can hear from their perspective. And definitely we also need more effective voucher program that assure that people have access to permanent home, not just temporary one. So why is it this important? I think it is very important because by working on providing people more safe and decent home, we can transform our community health, and we can prevent so many social and health problems that are not supposed to be there in the first place. And we can save so many healthcare costs by preventing fall of elders. And another thing that I want to make is that, another point that I want to make is that when we know that, because we know that how having a decent home is a primary basis of life, and according to the author Matthew Desmond, without a home, everything else falls apart. So I think it's very important. And I just want to give a shout out to people who helped me participate in this project, because it really allowed me to learn about how having a decent home is very important. Thank you.
Before we end here tonight, I want to say thank you again to everyone here at Community Indian Head, especially Julie and Rick. They've been a phenomenal resource for us these past 2.5 weeks. But then I would like to have Pam, our professor, come up here, Professor Pam Goodman. She is going to say that this is all us, and that we're doing such an amazing job, but really we wouldn't be here if it wasn't for her, so come on up. She has been the backbone of this immersion clinical, getting us set up for meetings and shadow experiences and everything else. So if we can all just give her a round of applause. She's really opened our eyes to community and public health nursing, and I think that's a challenging thing for students who especially enjoy the acute care setting like myself. Do you have any words, Pam?
I would just also like to echo the students' appreciation to Indian Head, to all of you. There's several community members that are involved here as well, and a deep appreciation to the students being part of the community and really working community public health, population health, nursing. There's quite a significant challenge in front of us as we are facing the aging population, as we're seeing resources continue to become more constrained. And this world that we're entering in is going to take very bright healthcare professionals in all levels really to understand how closely health is linked to many of the areas that the students have identified. And the only reason that they can take this into their practice wherever it is that they land, in acute care, primary care, ICU, community public health, population health, they now have had a really good, firm understanding about what's happening in rural communities. Our urban communities are somewhat similar, but they have a little more depth involved before they're going to feel this type of experience. But I think truly that rural environments are going to probably provide some significant leadership, because we're used to having to pool our resources. I think some of the ideas put forth when we look at rural population health and a lot of the community-based interventions, they're talking much more about coalition building, community development, and when you engage people who typically we don't have at the table, they become part of the solution rather than part of the problem. So it's a new or different way of thinking, but it's a way to provide community engagement and to have all of our voices together so that we can make improvement, whether it's substance abuse, whether it's housing, whether it's acute care, whether it's injury prevention. And I just can't thank you enough for allowing the students to really, what I say, work in community and public health, because it's very difficult for them to receive this type of very rich and vast experience. And honestly, they really have been phenomenal troopers. They have been pretty much on 24/7. They start early in the morning. They don't go until they go until pretty late in the evening. And when the tornado hit, I just said, you know what? Doesn't matter. We're putting our boots on, rolling our sleeves up. We're in wherever it is that we can potentially help. So again, kudos to community members. Thank you so much, and to our community and public health, population health nursing students. So thank you very much.
And right now we'd like to say goodbye to our live audience, and we'd like to thank you so much for joining us today.